Fertility Awareness Mastery Live is starting in July, and I can't wait to get started. This is my 8-week program designed to help you gain confidence using fertility awareness, and you are officially invited. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start the first week of July. Are you ready to jump in? Head over to fertilityfriday.com/FAM to register today. That's fertilityfriday.com/FAM. And make sure to join us before June 30th to take advantage of early bird pricing. This episode is brought to you by the Fertility Awareness Mastery Charting Workbook, the first beautifully designed, fully customizable paper charting workbook designed with you in mind. With 3 years worth of charting pages, the Fertility Awareness Mastery Charting Workbook has you covered. If you've been looking for a solid alternative to charting apps, you'll love this charting workbook. The Fertility Awareness Mastery Charting Workbook is available in both Fahrenheit and Celsius editions, and it's available in spiral-bound, paperback, and ebook versions. Head over to fertilityfriday.com/workbook to order your copy today. That's fertilityfriday.com/workbook. This is the Fertility Friday podcast, episode number 314. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Journal. I'm a certified fertility awareness educator and holistic reproductive health practitioner with nearly 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormonal health, and optimizing the menstrual cycle without hormones. I'm outspoken about hormonal birth control and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys. I know, I'm a busy girl, but I managed to fit it all in. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with us today. I'm excited to share today's interview with you. Today I'm sharing my conversation with Dr. Kyrin Dunston. And anyone who's listened to the podcast for a while will know that I love it when I have an opportunity to interview an MD. I love having the opportunity to learn more. What is medical school like? What perspectives did you come out of medical school with? How are certain issues addressed? How are doctors trained to deal with period issues? Why is it that so many women go to medical doctors and find that the treatment that they receive doesn't address the root cause? I think these are the important questions that we need to be asking and the important conversations we need to be having because we all need to have doctors. I mean, it's really important that we have medical doctors. There's so many different concerns and issues that all of us need to have a doctor. But at the same time, we have to understand where our doctors are coming from and understand the ways that they're trained and the conditions that they're apt to treat. And we have to have some of those answers about why certain period conditions are not really treated in modern medicine and what we can do about it, how we can empower ourselves. So this conversation is really powerful for, many reasons. But one of the reasons is because Dr. Dunston shares her personal experience going through medical school, having a traditional practice, and then going through a series of events that inspired her to switch the way she practices altogether. So switch from a traditional medical practice to a functional practice. And so this episode is important for all of us to hear, but particularly for health professionals, for doctors, because I know over the years, many doctors actually do listen to the show. And it's interesting to hear from medical professionals who learned in a certain way and then through experience in their practice transitioned to a different way of looking at things and a different way to treating patients. Because really, this is where I see the future of medicine and healthcare going. Okay, so let me introduce Dr. Dunston. Leading by example, OBGYN Dr. Kyrin Dunston lost a life-changing 100 pounds and healed herself from chronic disease by addressing the root causes of her overweight and dysfunction. This personal transformation in turn caused a professional one, and she left her OBGYN practice in 2011 to pursue a functional medicine practice after becoming fellowship trained in anti-aging, metabolic, and functional medicine. Dr. Kyrin's book, Cracking the Bikini Code: 6 Secrets to Permanent Weight Loss Success, brought her in-office natural weight and health restoration program to women everywhere. And as the host of her brilliant health radio podcast, she offers interviews with inspiring and insightful experts in functional medicine for women desiring to heal and achieve optimal health naturally. So, without giving any more away and without further ado, let's jump into today's conversation with Dr. Dunston. And I'm really excited to be here today with Dr. Kyrin Dunston. Dr. Kyrin, we met because you had me on your podcast and we had such an amazing conversation that I invited you to the show. So welcome to the show.
Thank you so much for having me, Lisa. It's really fun to be back here with you.
Well, let's just jump right in. I mean, you're a board-certified medical doctor, a board-certified OBGYN for over 20 years, as I talked about in your intro. And I always say lovingly, but seriousness, that whenever I have the opportunity to interview a medical doctor who's been classically trained, I always I'm dying to know what med school was like and all of those things. So I'm really excited to dive into that. But one of the questions I always ask my guests is, what brought you to the field of medicine? So 20 years ago, 30 years ago, whenever you decided to be a doctor, why did you decide to be a doctor? Like, what brought you into the field of medicine?
Right. So I always wanted to be a doctor. I kind of came here wanting to do that. And, I've been in the field over 20 years now. And just in the work I've done kind of in the spiritual realm, which is a whole other conversation, I've learned that I have been a healer for many lifetimes. So my mom has a picture of me listening to my favorite stuffed animal when I think I was 4 or 5 with a stethoscope, my Leo the lion. And so it was something I was always interested in. I was always interested in science, how things work, how the body works. I was always interested in helping people. And I always had a proclivity for how could we do things better. That was kind of my makeup as a child. I was the one who would take the TV apart to figure out how it worked and how we could make it work better. So it's something that I always wanted to do. And it really is something that was in my family. I have one grandmother who was a registered nurse. I have another grandmother who was a pharmacist. So those two strong women really had the science background and the healing background. And then I had a great grandfather and a great uncle. They were brothers who were physicians. And my great grandfather was actually the 3rd African American to graduate from Jefferson Medical College in Philadelphia, where I went to school. So I really came from a history of people who were healers and scientists. And it's something that I always wanted to do. When I was in college, I volunteered at a women's health center and loved that. I really loved talking with women about their health problems. It's interesting. My best friend in high school, I went to Bronx High School of Science, and she and I always conversed periods and urination and bowel function. And her brother, who was older than we were, and he was a student at Dartmouth, one day he said to us, we were at the dinner table, and he looked at us and said, "Why are you always having these scatological conversations?" And we looked at him like, what is scatological? And so, of course, we had to look it up. And it's about body fluids and body activities and functions. And I was like, yes, we love having scatological conversations. So what better profession for somebody who loves to have scatological conversations than OBGYN?
Well, I love learning new words. They're new to me. And it's so funny that you say that. So I didn't know, I've never heard the word scatological. And I have a lot of friends who are nurses. And so nurses constantly have scatological conversations. They're always talking about bodily fluids. So it makes total sense. And then so am I. So here we are. Well, so one of the things that really struck me in our first conversation that we had a little while ago was that you just experienced some changes in your viewpoints. So once you graduated medical school and you began practicing, at some point you started to kind of see things a little bit differently. I mean, the fact that you had me on your show and we're talking about the menstrual cycle as a vital sign and questioning the use of birth control isn't really the typical mainstream medical perspective. So can you share with us just some of your professional experiences that led you to look beyond what you had been taught in medical school?
Sure. Well, it gets back to my childhood again. So I was raised in Manhattan by a very progressive mother. Her name's Jerry. We used to call her Granola Jerry. And she was really good friends with Gary Null, whom some people listening may be familiar with. I don't know how many New York Times bestsellers he's written, but he really was one of the leaders of the whole health, holistic health movement. And he had a health food store very close to where we lived. And we were in there several times a week talking to Gary. So this is me in grade school, my mom toting me and my sister behind, and he would educate her on nutraceuticals, which he sold in his store, and making healthy foods. So she used to make her own yogurt and all kinds of things in her own sprouts. She always had sprouts under the sink making sprouts. So I really was raised in an environment of natural healing. My mother, it was very healthy, didn't take medications. My dad didn't. And if my sister and I got sick, she would give us golden seal and echinacea and make us sweat it out. And none of our friends did this. We thought she was crazy. She would give us, black bean burgers instead of beef burgers. And we just would make fun of her incessantly, but we actually were pretty healthy kids. And so here I decide to go to medical school because I'm the type of person that when I decide I'm going to do something, I'm all in 2 feet. And so I want to be a healer. I want to help people. I'm going to go get all the information about how to do this. So I went to medical school, which I loved because I was just a geek about how do things work. And, when I got to learn about the tendons in the hand and how they pull them and how it's really like a puppet. I mean, it was thrilling, exhilarating, fascinating. And then I went to residency. And of course, I wanted to be a good resident. And so I did what I was told to do. And so they, in hindsight, I didn't really realize what was happening at the time. There was this big shift from learning all the science and biochemistry and physiology of the body to, well, this is how you assess a patient. These are the symptoms. These are the diagnoses. You make a diagnosis and then you give a drug or you do a surgery. Diagnosis, drug, surgery. And so I just did that because that's what I was taught. And I really stopped. I didn't question anyone. I had no reason to question anyone because these were the people doing it. And so they knew how to do it. So I need to do what they're doing. So that's the type of medicine that I practiced for many, many years. But then my own health took a downfall and I ended up weighing 243 pounds. I had chronic fatigue. I was tired all the time. All I did was sleep and work. And even though I had kids and a husband and a family, all I did was sleep and work. Wasn't really living. And I had something called fibromyalgia, which is pain in the body. I had anxiety, depression. My hair was falling out. I looked and felt 20 years older than I was. And I bet people, I didn't feel like myself in my skin. I didn't feel at home in my skin. And I really got to the point because here I am, a board certified physician who's supposed to know more about women's health than anybody else in the country. And I'm running tests and they're all quote unquote normal. And I can't figure out what's wrong and fix it. And I go to my internist and I say, something's got to be wrong. And she runs tests and they're all quote unquote normal. And as this progressively worsened over years' time, I really got to the point where I thought, if this is what life is, I don't even think I want to live it. But I really didn't have a choice because I couldn't figure out an answer. So I just kept going through the motions and breathing in and out and putting one foot in front of another and doing what was mine to do. And then through a series of miraculous events, I mentioned the spirituality earlier, I came across this thing called functional medicine. And when I learned about it, it wasn't somebody giving me their opinion. It was really, I heard scientists and doctors talking about tests I had never heard of. Why? I'm board certified OBGYN. Why have I not heard of salivary hormone testing? Why? What is this? How is it validated? Oh my gosh, it's validated. Why don't we use it? Long story, right? That's a political thing. But I started using it on myself. I actually initially worked with a naturopath when I heard about functional medicine and started doing salivary cortisol testing, salivary hormone testing, did the right thyroid tests and read them the right way. And even though I had checked my thyroid at least 10 times and it was quote unquote normal, discovered that I had hypothyroidism, low functioning thyroid. So I had progesterone deficiency, testosterone deficiency, I had a flatline cortisol. Then I started going to conferences at Life Extension Foundation and the American Academy of Anti-Aging Medicine. And I started learning about food sensitivity testing and the importance of gut health and healing for health, and learned about functional stool tests. Never heard about these things as a traditional physician, and came back, I had leaky gut and I was sensitive to all the foods I was eating on a regular basis. I think there were 40 foods on my list, really bad. And so I immediately eliminated them from my diet. And I started noticing benefits, and the weight, actually, it was like someone popped a balloon. The weight just started coming off. My energy started coming back. My hair started growing. My skin started shining. My outlook improved. And so slowly but surely, it was like Hansel and Gretel following the breadcrumb trail. I'd go to a conference, learn about tests, do the tests, fix whatever it was wanting me to address. And my health just started improving. And so after a while, all my patients who are middle-aged women with the same problems I was having, right? Overweight, tired or can't sleep, depressed, anxious, no sex drive, hair falling out, skin problems, gut problems, autoimmune disease, like all these things. They really never got better. And I was noticing this in my practice along with my health problems. And I started saying to my colleagues, like, are we really helping anyone? Because even though I put this woman on an antidepressant and a sleep medication and a birth control pill for her heavy, painful periods and fibroids, like, she never gets to a point where she says, oh my gosh, Dr. Kyrin, I feel great again. Thank you so much. It's just like you would just add diagnoses and add medications, and it would just be this kind of slow downward spiral of aging. And so my patients saw the changes in me and they're like, what are you doing, girl? Because we want that. So I started doing this work with them and quickly realized you can't do this type of care in a regular medical practice. So regular medical practice has 5 and 10-minute visits, and it only takes a few seconds to write a prescription. I can assess you, do a quick exam. You have insomnia, here, take this, right? You have heavy painful periods, here, take this birth control pill, right? That didn't work. Take that one. That didn't work. We're going to do surgery. So, functional visits are an hour, if not sometimes more. There's a lot of education. And so I really ended up starting a separate practice on Mondays and Wednesdays where I saw my functional medicine patients. But then what was happening is all my regular patients I was seeing on Tuesday, Thursday, Friday, would say, well, my board certification says that this is how I'm supposed to treat you. I'm supposed to do this surgery, hysterectomy, or I'm supposed to give you this birth control pill or this sleeping pill or this antidepressant. But you may be interested in this other type of medicine that I have learned about. That is the reason I lost 100 pounds and healed myself from chronic fatigue and fibromyalgia and all this. And this is what it entails. And any educated person, you explain this to them, they want it and they get the difference. They get that they're being sold just pharmaceutical treatments that are Band-Aids that don't fix the root cause. So when you explain to them the difference, they say, I want that. So all my patients then were coming on Mondays and Wednesdays to see me in the functional practice. Well, after several months of that, I realized there wasn't an integrity anymore doing traditional medicine. So I actually closed that practice and retired. And that was 2011. And I've done this full time since, so 9 years. And so that's really my transition. The issue is that we physicians, once we're told we're board certified and we know everything about health, right? We get a certain type of arrogance that incurs contempt prior to investigation, meaning we're not willing to be open-minded and look at anything else, even though it could be valid because we know everything that's valid already. So why would I look at anything else? And there is this kind of arrogance that permeates mainstream medicine, and it's almost, I know people say you don't sound like a doctor, right? It's almost like a cult, but it really certainly is a religion. And it's the religion of the double-blind placebo-controlled trial, which came about in the past 50 to 70 years. It didn't used to be our gold standard of medical care. If you look at the history of medicine in America, since settlers came here, although I do acknowledge there were indigenous people here way before other people came, and they used traditional methods of healing like plants, right? And they lived with the earth and in harmony with nature. But here settlers came, I probably wasn't one of those. They actually, medicine was interesting. Like orthopedic surgeons were doctors initially who worked on animals, big animals like horses, right? And so they thought, well, you work with big animals, you can work with the bones. And so those were the initial orthopedic surgeons, believe it or not, were veterinarians who worked on big animals. And there really was this apprentice factor to medicine. And so there wasn't really medical school. You had to go apprentice with someone. But I mean, think about it. Like they used leeches for bloodletting, and they didn't know about germ theory, and that there was these things you couldn't see called bacteria and viruses that made you sick. And so there was just a lot of superstition, and didn't really have a scientific basis. So fast forward to the last century and discovery of germs and Madame Curie and discovery of antibiotics. And so that was such a powerful change in medicine, right? The discovery of antibiotics, that how powerful they were and that they could protect us from these infections, that really became the Holy Grail. And then we discovered the double-blind placebo-controlled trial, and that became the basis of science. But now, knowing what I know about functional medicine, knowing what I know about spirituality and energetic medicine and the nature of us as energetic beings, right? We're not physical beings, we're energetic beings who happen to have a physical body. It really, the double-blind placebo-controlled basis of medicine with pharmacological intervention doesn't allow space for things like quantum physics, which we know to be now kind of that the nature of reality is changeable based on the observer effect. And, that's a whole other conversation. But to get back to the track, because I'll just take an idea and run with it. I became open to learning something new when I had pain. So it's been said, I think Michael Bernard Beckwith says, pain will push you until your vision pulls you. And so I had so much pain that I became open-minded. And that's all the doctors who practice this type of medicine would and weren't finding answers, or they had a loved one who had so much pain and weren't finding answers. And then once you get through that pain and you find these tools and you use them to improve your health, then your vision of what's possible for all of us starts to pull you, and you go, oh my gosh, we've been going about this the wrong way. And I don't mean to say that mainstream medicine doesn't have miraculous tools, miraculous, right? For acute care and the medications that we do have available, tremendous, right? Tremendous. We've increased our lifespan by decades in the past 100 to 200 years. And we can even do better,
Well, let me jump in there.
Yeah.
I mean, thank you for sharing. There's like a few, like so many different points of what you said that I'd like to highlight. But what I think is really interesting is that after years of doing this podcast and interviewing hundreds of guests, one of the reasons why I asked, what brought you into medicine and what kind of caused that shift in the way that you practice, it's a consistent, when I ask that question, there's consistently a personal situation. So whether that's a personal story of illness that the individual had to overcome, or a family member or something along those lines. And for others, it's years of seeing that their patients weren't necessarily improving. Mm-hmm. So yeah, I think that that's a really important piece of it, because something that I've really started to just, I suppose, just to put into words, is that the truth is always the truth, whether you believe it or not. So for example, we all kind of know that eating healthy relates to health, and eating like not healthy, it's debatable what's healthy, right? Everyone has a different idea of that, but there's certain tenets of health that are just true, right? Because if you are ill and you change things and you become better, so that's an actual result, right? So if you're in a modality that isn't necessarily healing the body, and then you switch to a different modality where you're getting different results, again, the results kind of speak for themselves. So you touched on the medical model, which a lot of people refer to as the allopathic model. When you said, I went to school and, you diagnose, and then once you diagnose, it's drugs or surgery. And you mentioned that in a short appointment, it's either, you know what I mean? Like you have 5 minutes and it's like, that allows you to make a diagnosis and give the solution right away. So one of the questions that I think my listeners would be really keen to hear about specifically is, thinking back to medical school, what were you taught about the menstrual cycle? And what were you taught about essentially how to solve issues related to menstrual cycle health? And how does that differ from how you handle your patients today, given what you've learned?
So in medical school, the first 2 years are really a lot of didactic lectures and learning about the systems, anatomy, physiology, and we have anatomy cadaver labs, and we dissect the body. And so it's really learning. And so I learned how the body functions, about the in the ovaries, egg production, how that evolves, what hormones are produced and in what sequence, how the brain controls fertility, how fertility occurs or doesn't occur for men and women. So I really learned all of the physiology and the biochemistry around that, without, in the first couple of years, there isn't really a large talk about interventions or treatments. It's just getting the correct information on how systems function, how cells function. And then in the third and fourth years, there is more focus on, we start going into the clinic, and at least this is how it was when I went through. Might be different now. We started going into the clinic and really taking pharmacology and learning, doing surgery on our surgery rotation, and then learning from the doctors that we would preceptor with how things were handled. And so that's where we started having introduced protocols and treatments. And like I said, in residency, you got more of that and really in depth in your specialty. Because in med school, in the third and fourth year, in the third year, I basically rotated around every 6 weeks to a different specialty. And then in the fourth year, there's depth in specialties. So how does that compare to what I do now? So as I said, it was really that I was told that taught how the normal menstrual cycle functions. And I was told, well, if someone has irregular periods, painful periods, heavy periods, fibroids, endometriosis, pain associated with their cycle, basically any cyclic complaints, that the treatment was a birth control pill. That's what I was taught. And that you try the lowest dose, right? And that, you try the latest and lowest dose and you see how that does. 3 months is a trial. And then you see how they do. You see them back in 3 months. And if not improved, you try a different pill, right? Maybe a little bit higher dose, different hormones in it. And if that doesn't work, then depending on the issue, you're generally going to go to surgery, some type of laparoscopy where you look inside. Now, at some point, you might have done an ultrasound and you probably did a pelvic exam to look for any anatomic defects to see if you felt anything, which you may or may not feel. You might have some fibroids, you may not, you may feel some ovarian cysts. But that's generally the protocol of how these things are handled, whether you have ovarian cysts, fibroids, heavy painful periods, suspected endometriosis, whatever cyclic pelvic symptoms are going on, birth control is going to be the answer. Now, there are other forms of the birth control that they may use now, implants or hormonal IUDs, something to basically shut down the female hormones. But there's really not much thought. There's no discussion of what's causing that. Never in my clinical training did I have any doctor or clinician bring up the fact of, well, we need to look at why somebody has that. And that is the whole basis of functional medicine. It's not, what can I do to suppress the symptom? And just because I suppressed your symptom with a pill means you're hunky-dory. It's, why are you having this? Because you have to speak the language of the body. And the body uses symptoms to get your attention, to pay attention that something's wrong. And the something that's wrong is not, your body's not saying, I need a birth control pill. Please give me a birth control pill. The body is not saying that. Body's saying, I have this symptom. Please look at something that's causing it and figure it out to fix it so I can come back into balance. Because the body naturally wants to heal. So by the time you have heavy, painful periods, ovarian cysts, fibroids, there's something so out of balance that the body cannot fix. And it can't fix it because there are drivers of that dysfunction, and you have no brake on the dysfunction. Every disease has a driver, and it should have a brake. And when you get symptoms, it means that your driver is so high and your brake is faulty, and you have to decrease the driver and increase the brake to bring the body back in homeostasis. And so I wasn't taught that. And then thank God I found functional medicine that said, like, you're 243 pounds, your fat is not the problem. It's a symptom of the problem. We all think the fat is the problem. If I could just lose the fat, then I'd be fine. That was my thought. And I've worked with hundreds, if not thousands of women who are overweight. And that's all of our mentality. Our body is a bank account. It's calories in minus calories out. If I can exercise like crazy and starve myself, I'm going to lose this weight and then I'm going to be fine. And that is a lie, right? That's why all weight loss programs have only a 6% success rate at 2 years in helping people lose the weight and keep it off, because your body is not a bank account. It's a complex biochemical equation and system. And how your body handles calories, which can be stored as fat, determines your weight. And what determines how your body handles calories? Your hormone balance, right? Hormones are the chemical messengers, the communicators telling your cells what to do on a second-to-second basis. Store that calorie as fat, or open the fat cells and burn those calories as fuel, right? These are the signals that your cells are getting or not getting. You got to look at toxicity, right? Because if we have too much toxicity, your body can't let it swim around because it's going to make you sick, so it has to store it. Well, where does it store it? In fat, right? So if you're not getting rid of those accelerators of inflammation, those toxins, your body's not going to let go of the fat. We have to look at nutritional insufficiency, micronutrients, vitamins, minerals, nutrients that our body needs to burn fat and get rid of it, and that our body needs to function. And 70% of us in the industrialized world are micronutrient insufficient. So we have to look at that. So you have to look at these drivers and mitigators of disease and symptoms. So now that's my whole approach. If someone comes to me and they can't sleep, why can't you sleep? I don't just give you a drug to knock you out. That is a tool that can be used if needed, and I'm grateful we have that tool, but it doesn't fix the problem. And people think, it's so funny because I talk to patients. I do some traditional telemedicine sometimes, and I talk to patients and I say, well, do you have any medical problems or take any medications? And they'll say, no, I don't have any medical problems. Or are you on any medications? Oh, yeah. And they list, 5 or 6 medications, antihypertensives, cholesterol medicine. And I go, oh, but you told me you don't have any medical problems. They go, no, it's all controlled on the drugs. People think they're fine and they don't have any medical problems, and their health is as good as it can be when they are on pharmacologics to control these drugs. And that is a lie. It's not true. And, but this is what we've all been trained and bought into as being our healthy healthcare. And so, if you're on a medication to make you sleep, you're not getting the proper brain waves and REM cycles to restore your body, and it's not restorative, and it's not a long-term solution. And it belies the fact and masks the fact that probably your cortisol is out of balance, your stress hormone, which determines how your immune system functions and whether you're going to get a virus when it comes around or not, and how sick you're going to get from it, or whether you're going to get cancer or not. Cortisol determines your immune system function. Most people who have insomnia have a cortisol problem. If you just take something to knock you out, you are denying yourself the ability and opportunity to fix that cortisol that's probably going to cause you problems with some other system down the line. And you're thinking in ignorance that you're good when that's not true. So it's a whole different paradigm. But like you said, the truth is the truth, whether you see it or not, or are willing to see it. This was always there, but I just had no open-mindedness to see that what I knew as an allopathic physician was a small amount of what is available, the body of knowledge and expertise to heal the body.
Wow. Yes. I'm fist bumping over here. So I think, there's just so much of what you said that's really important. I mean, I feel like the listeners should just listen to that again, because what you're talking about is a difference in paradigm. This can be challenging, I think, to explain, because when you're talking about the medical system, it's not to say that you're trying to slam it or trying to, be really critical of it. I feel that in a conversation like this, we're trying to explain it so that a person who's seeking medical support can understand what this paradigm is. And there's a difference. So the paradigm that you've described is one where the questions are not being asked. What is the underlying factor, and how can we restore the body to homeostasis? And this is essentially what I've been talking about on the podcast for 5 years, because I'm looking at the world through the lens of a menstrual cycle, right? Like it's a different approach. Most people don't do that. But when you look at it from that perspective, is what you said about the body. So the body sends you messages when there's something out of balance. The menstrual cycle kind of starts going haywire when there's something out of balance. Your body doesn't have a telephone or a cell or Wi-Fi.
Or email.
Or email. It can't send you a message in words to say, look, there's something wrong. So these symptoms are the only real way that our body has to try to wake us up and to understand it. And what you described beautifully is that these medications are helping to control those symptoms. So they're controlling the body's way, essentially kind of minimizing in many cases, the body's way of trying to tell you that something's out of balance. And so you feel like you're fine. And it doesn't mean there's anything wrong necessarily with taking that approach. But I feel like what we need is that conscious level about it. If you're conscious and aware that this medication isn't healing you, but it's simply controlling those symptoms, and you're not necessarily fine, and you're comfortable with that, then I feel like that's a big difference to someone who really doesn't know that is the approach, and that it is actually possible to look at another approach that would actually look at those underlying factors that are causing those symptoms.
Right. So, just as you were talking, this analogy popped into my head that I have to share. It's like if your kids are wanting your attention and your time and your love, and they're coming to you and wanting to interact, and you just tell them, here's some Doritos, sit in front of the TV all the time. Like, is that the answer every single day, all day? Maybe it's a tool that you use every now and then, but if you do that long term, you're going to end up with some really disturbed kids who don't get their need for connection and love met. And it's that's the analogy I thought of. But I think it is confusing for people. It is really confusing because we are really taught from the time we are born in this country that the doctor is the authority, the doctor will fix you, and that doctors are to be respected and not questioned, that they know everything. And so we have really bought into this system, and all of us collectively, and that our insurance should pay for us to be healthy, and anything that our insurance doesn't pay for, we don't want, right? And that our health expenses are just like our other expenses, and they should be mitigated at all costs. We want to spend as little as possible on our health. We don't see it as an investment, and that we need a drug. I talk to patients every week who want to tell me, I need an antibiotic. Like, I ask them, what symptoms are you having? And they go, I need an antibiotic. Why do you need an antibiotic? Because I have an itchy throat and I just want to get on top of it. I hear that every week. I want to get on top of it before it becomes a problem, which shows to me a total lack of understanding about what an antibiotic is for and how we make the diagnosis of needing one, and a lack of understanding of the harmful effects of antibiotics. So I think that we are trained into this system of the medical system's the authority, the doctor is one who heals me, and that I need a drug and my insurance should pay for it, right? So when we see anything different than that as consumers, we are very suspicious and very wary. We're like, they don't know what they're talking about. I mean, I even look up doctors that I respect, like Dr. Mark Hyman, who has written several New York Times bestsellers, Ultra Wellness. He's, I think, one of the creators of the Institute for Functional Medicine. There are two organizations that train functional medicine doctors right now, the IFM and the A4M. And I think Mark Hyman was one of the creators of IFM. I mean, he's a prolific physician. He's an educator of physicians and lay people, and everything that he teaches is documented. I mean, nothing that I do isn't documented and proven. And so I looked him up for some reason on Wikipedia, and it says that he's a charlatan. And it's this kind of thing that really keeps consumers confused. But it says that he's a charlatan. But the average person doesn't have the ability to know if that's true or not, or to educate themselves if that's true or not. And so what do you do when you're afraid? Because you don't want to make a mistake and try something that you could waste your time or money or be hurt by, is you go with what the herd says is safe. And that's mainstream medicine.
Whether you've just recently discovered fertility awareness charting and you're just getting started, or if you've been charting for a while, I know that you have questions either way. Questions about the process, about charting, and how it all fits together. And I have some exciting news to share with you. I'm hosting a free workshop on June 5th, 2020, entitled Introduction to Fertility Awareness Charting. Discover my top tips and tricks for charting your cervical fluid, basal body temperature, and cervical position. Head over to fertilityfriday.com/webinar to register today. That's fertilityfriday.com/webinar. And try to join us live for an opportunity to ask your questions during the class. I can't wait to see you there. Now let's jump back into today's episode.
And there also is very much a herd mentality when it comes to everything that we do in life. So pharmaceutical companies, insurance companies, and the medical establishment, I'll call it, are really who profit financially from the medical system the way it is, which is disease management, not the creation of health. Well, they also run media, right? They pay for all the commercials that fuel your shows that you watch and your news that you watch and your newspapers. They have so much money and buying power. I mean, every other commercial you see is a drug commercial. Every other commercial you see is an insurance commercial, right? They're not advertising for health insurance because that comes for most of us through our employers for the past many decades. But they advertise for car insurance, right? Every other commercial for car insurance because they make money off of that. And that funds their other activities. And so it keeps them forefront in the mind of employers. All that we are trained into a system, and then we are not given information that could be contrary. So even though we have free speech in our country, right, one of the founding tenets of our Constitution is that we have free speech. You may be saying it, and this is why we need people like you and like me, and all the other hundreds of podcasters out there who talk about alternative health, holistic health, to get the word out, because people aren't going to see this information watching the nightly news or Good Morning America, right? Because they censor it, because the drug companies don't want people coming on there talking about why the pill isn't the greatest thing ever. They're going to have doctors on there talking about how it's about women's liberation and you're trying to set women back decades and, all this. And they don't want people on there talking about it. So I think it's very challenging for the average person. And this is why I say doctor means teacher. And my job as a doctor is to educate you so that you can make a decision for yourself. I don't tell you do this because I say it's right or helpful. I say, let me teach you. This is how the menstrual cycle functions. These are the hormones. This is their chemical structure. This is how it functions in the body, just like I learned in medical school. And you're having these symptoms. Well, let's see what we can do to evaluate that. We want to look at why you're having that. Well, maybe we should do some salivary hormone testing to check your levels of estrogen, progesterone, and testosterone. And they might say, well, my regular doctor said we don't do that, which is standard mainstream medicine. I say, well, that's true. In mainstream medicine, there is no standard of care for checking women's hormones. But let me ask you, we check your cholesterol and all the different types of cholesterol. We check your blood pressure, your temperature. We weigh you. We do blood chemistries. We check all this other stuff. Why does it make sense to you that we don't check your sex hormone levels? And the average person will say, no, that doesn't make any sense. Right. Well, we can do that. And we do that in functional medicine, right? Why don't we do that in mainstream medicine? Their argument is there are no standard values, which is a lie right there, because the lab comes back from the lab with the standard values on it. So I don't know where that's coming from, right? And so we can check it. And so you talk to them about that. And then I say, okay, well, we could do a blood test, but I would recommend a salivary test, and this is why. Because these hormones are made from cholesterol in the body, and cholesterol is made from fat, right? And they know that. They say yes. Okay, so these hormones are oil. They're like oil because they're fat, and your blood is like water, right? Right. So what happens when you try to mix oil and water? They don't mix. They separate out. Okay, so these hormones have to be carried around on proteins in your blood to get from one place to another. So I say, okay, I call those FedEx trucks. So we can tell how many FedEx trucks you have, but when it's throwing the packages into the cell, they stay in there for like such a small fraction of a second that you can't even count, that it's almost impossible to get an accurate measure of how many of these are not only in the FedEx trucks, but being delivered to cells. And what we really want to know is how many of these hormones are inside the cell, because that's where they have their action. They go in the cell. And so one way that we can check what's inside the cell is with salivary hormone testing, because the saliva that's secreted from the cell has the same contents as what's in the salivary cell. So if we collect saliva, we know how much of these fatty hormones are inside the cell. And most people go, oh, that makes perfect sense. So I don't say you need to have salivary hormone testing because I said, right? No, I'm going to educate you how your body works. And then does that make sense to you? I've never had a person say that doesn't make any sense. And then they start getting it. Okay, we do the salivary hormone testing. Oh, look. Your estrogen, and there are 3 different types of estrogen we check for, is really high. And look how low your progesterone is. We know that optimally healthy people should have a ratio of like 1 to 10 to 1 to 20 estrogen to progesterone. So you're out of balance. So this is why so estrogen is the weight gain, water retention, PMS, depression, anxiety hormone, right? You need enough of it to feel good, but if you have too much, it's going to cause those things. And progesterone is the weight loss, diuretic, anti-depression, sleep, feel good, happy hormone. And it's the menstrual timekeeper, and it's the light flow menstrual time causative. And so you need a balance you need them both at the right levels. And so if the estrogen is high, then the next question is why, right? Oh, okay. Are you not excreting the estrogen that you make? Because you've got to get rid of everything that your body makes. You've got to get rid of. You have to detoxify it. So is estrogen toxic to women? No. But if you have too much, it will become toxic and increase those symptoms we're talking about. So you get rid of it through your liver and your gastrointestinal tract and your stool, right? You poop it out. Well, if your estrogen's high, the first thing I look at is, are you pooping it out? And is your liver sanitizing it out, dumping it into the gut? And then we look at all the things that could go into raising your estrogen. Mm-hmm. And then we look at, why is your progesterone low? What's going on with your ovarian function? Your ovary is the main creator of progesterone. Why isn't it doing that? And there are a lot of reasons. So I find that when I educate people and take them through this, they totally get it. But it's funny because I can work with someone for 3 to 6 months and they can get so much benefit in losing weight and periods regulated and fertility increased and all of these things. And but there's amnesia that happens because this information isn't being reinforced in the outside world. So I inevitably find people come back and maybe they'll come back 3-6 months later and they'll say, oh yeah, I started taking this birth control pill because my doctor told me to take it. And it's like, what? Like, but we explained, now remember we talked about this. Remember we talked about salivary hormone testing. Remember we talked about, oh, yeah. So there's this amnesia and there's this pull to go back to what everyone else is doing. So people that really take this type of medicine and run with it and never look back and their health is transformed forever tend to be people who have a certain type of constitution where they are independent thinkers. And they're also not people pleasers, so they can take care of themselves and say no to what doesn't work for them and really get it. But anyway, that's kind of the difference. Yeah.
I wanted to jump in and get your thoughts on something because with me, because the work that I do, helping women to understand their menstrual cycles and helping them to not only use it as a tool for natural birth control or conception, but also as a window into the health.
Yeah.
So what I find, I have conversation after conversation pretty much every day with clients where it's really connecting them to what's happening in their body. So tuning them into those subtle messages that their body is trying to tell them. And you alluded to the fact that from the time that we're born, essentially, we're born into this system that is constantly broadcasting a very specific type of message about healthcare. And that message is that we find the answers outside of ourselves. There are experts who know more than we do. And those are the ones that we must put our faith into. And you also mentioned towards the beginning of the interview, something that you might be able to get back to a little bit. You mentioned medicine is like a religion.
Right.
And I've certainly felt that way because when I was young, so mini tangent here, but when I was young and I learned about science, I mean, I've always just been fascinated by science. And the way that I was taught about science was that science was this practice, not a religion, that involved creating theories. And you would have a theory and you could basically ask any question, right? Like there's no limit. This is how I was taught. So you could ask any question and essentially the research was there to test out your observation. So if you have a theory that that hormonal imbalance contributes to health issues, then you can construct experiments to test those theories. And all you do when you're having these tests, so these scientific experiments, is adding proof for your theory or showing that it's less likely to be true. So you're but you never, this is how I learned it. You never really prove the theory. It's always a theory. You just have certain theories that have more supporting evidence. So there's theories that have years of supportive evidence, and there's other theories that have conflicting evidence. But the way I was taught from when I was young about science, and I really gravitated to that idea because it was so fascinating, was that you're never really like proving anything in the sense, but you have support and additional evidence to support your theory. So getting back to my point, so after that little tangent, what's interesting is that from a young age, we're taught to look outside of ourselves for answers. Now, most of us aren't medical doctors. Most of us haven't necessarily gone through that training. But if you've lived in your body for your entire life, then I would be hard pressed to say that any medical doctor would ever know your body as well as you, because that is where you live. So I'm curious to hear your thoughts on it, because the way I've looked at things, the way I've supported my clients, just to kind of like one of the main things I've supported, all of my clients to do is to actually start to trust their own intuition, because the truth is the truth. You either feel good or you don't. Your menstrual cycle is either in line or it's not. Your cholesterol is either out of whack or it's in balance. And if you do something, you make a change, and then you see that shift in one way or the other, it either shifts or it doesn't, right? And so I'm curious your thoughts on that, because I feel like it's not even necessarily that we should be replacing these know-it-all doctors for know-it-all functional doctors, and we should always be going to people who supposedly have all the answers. It's a challenge because not everybody is trained and not everybody can interpret scientific information necessarily. But I still think that it would be beneficial to move towards more of a just an acknowledgement that our own intuition, our own feelings, the way that we feel in our body, that matters.
Absolutely. I think we really are socialized into self-abandonment in so many ways, and not having a central locus of control with ourselves, knowing who we are, listening to the signals, knowing what they mean, learning how to interpret the signals. I mean, who's teaching us that? Like nobody. And so part of my journey through functional medicine has also been relocating the locus of control in myself, physically, mentally, emotionally, spiritually. And so it's something that I really, when I work with patients, because you're exactly right, Lisa, you can practice a functional medicine approach the same way you practice an allopathic medicine approach. And I see doctors do that. But I really try to foster that innate knowing in my patients. And I work with a lot of homeopathics with my patients. And it's interesting, I am working with this young woman who's having a lot of gastrointestinal problems, and she has Hashimoto's. Now, she didn't know she had Hashimoto's because her doctor didn't do the right test, but she knew she didn't feel right. And thank God she trusted that. And she came to me. And I diagnosed her, and then we've been working on her autoimmune issues. So I have her working with the homeopathic. So I had given her instructions, because you have to kind of grade them up as your body tolerates. So you really have to learn how to tune into, am I ready to move up to the next level or not? Am I ready to add that next homeopathic or not? So I explained that to her. We had a nice in-depth conversation about it. And then she calls me and she says, I don't know, Dr. Kyrin, am I supposed to go to the next level? And I said, I just explained to her again, I really would like for you to start listening to your own body and listen to what it's telling you, and you decide. And then what's the worst that happens? You go up and you have adverse symptoms, then oh, I wasn't paying attention to the symptoms. I shouldn't have gone up, or I shouldn't have added that other one. I need to back up, or I need to go forward. And I think that is so vital, because when we abdicate our self-knowing and our self-responsibility to a system outside of us to heal us, we give up all our power. And that's kind of a soulless, unsatisfying, empty way to live. And I don't think it's how we were meant to live. And so for me, fostering people's personal empowerment is huge. I tell patients all the time, you know yourself better than I will ever know you. You know yourself better than anyone should ever, will ever know you. And I may give a suggestion, but if you immediately feel like, oh no, that's not right for me, you need to honor that, right? You need to say, yeah, this doesn't sound right for me. And I say, fine, right? You have an innate knowing. And when I weighed 243 pounds, that thing was so shut down. I had no idea that I had that. But now I know that I have to honor that above all else, and that trusted, still small voice, what I follow. And sometimes a test is helpful, having said that.
Well, these are all tools, right? These are all tools so yeah, I had chills when you were saying that. It just resonates so deeply with me, because in the way that I've looked at it for a long time, and the way that I talk about it, is that I look at healthcare, you're sitting around a boardroom, and each medical professional, each health coach, whoever is supporting you on your journey is around that boardroom table, and they all have a certain specialization. So I think it's helpful even just to frame it that every health professional that you go to, whether it's a psychologist or an OBGYN or a functional medicine doctor or a naturopath or a chiropractor or whatever, all of these individuals have been trained in a specific modality. So each individual professional has a set of tools. And within that profession, you have different, like you mentioned, some functional practitioners are very much like, okay, so you have this issue, take these supplements. So instead of prescribing medication, it's prescribing supplements in a very kind of similar way, and others go deep. So even within it, so you're at the head of that boardroom table, and it's a hard place to be, to take that full responsibility for your health and to acknowledge that I'm the one that has to make that final decision. I can't just, if I abdicate my healthcare to somebody else, as in the word that you used, then really you're releasing some of that power. But if you take the time to inform yourself and to make those decisions, it's harder, because then you're kind of on the hook. But at the same time, you can do what resonates with you. There's something that you said towards the beginning of the call, and I feel like this might be a good place to, as we kind of draw towards the end of our call today. So one of the things that I've often said with clients, when it comes to incorporating a bit of spirituality, a bit of, not necessarily spirituality, even I don't know that that's the right word, but with menstrual cycle charting, it becomes clear how significant of a factor stress can be, because it literally shifts the menstrual cycle, whether it's chronic or acute. And one of the ways to reduce stress then is to, calm yourself and engage in different practices. And so getting to my point, you mentioned the placebo, kind of like the double-blind placebo-controlled trials. You mentioned that our bodies there's an energetic component to us that isn't really discussed in medical science. And when you mentioned the double-blind placebo-controlled trials, you mentioned that concept of, I don't know if I'm going to say the right word, but basically the effect of the observer. And so for the listeners who heard that and were kind of like, what does that mean? My understanding, because after you read thousands of research papers, you see it over and over. It's fascinating. A double-blind placebo-controlled trial, what that means is if you have, let's say, nutrient X, and you want to find out if it has a certain impact in the body. To do a proper trial, not only do you have to blind the participant. So if I'm the participant, I can't know if I'm getting a sugar pill or if I'm getting nutrient X. You also have to blind the doctor who's administering nutrient X. So the doctor can't know if it's the real nutrient or the sugar pill. Because the power of our minds is so strong that if I know I'm getting nutrient X, I will have a beneficial effect in many cases, just because I think it's helping. And if the doctor knows that they're giving me that nutrient, because they know, it could make me have a positive effect. And we call this the placebo effect. We call this an annoyance. We call it something that interferes with our research. When what is the potential if we can think something is helping and it can help? So I'm sure you have something to say about that.
Absolutely. So yes, right. So we say it so blase, double-blind placebo control. I mean, every study, like that's the gold standard. But what are we really saying is exactly what you said, Lisa. We're saying that what we believe about our patients and what the patient believes about the treatment and what we believe about the treatment causes an outcome. And if we believe that it's beneficial, it will be beneficial. And if we believe it won't work, it won't work. And so this is the standard that every treatment is tested against. But we totally are ignoring the fact that placebo effect, and it can vary 10, 20, sometimes up to 50%, just based on belief, will get a clinical outcome. So that means, like, if we take an antidepressant and we treat half of a group with an antidepressant and we prove they're depressed, and we treat the others with sugar pills, and we tell them all, we don't know what they're getting, they don't know what they're getting, that a certain portion, 10, 20% of the people who are getting sugar pills are actually going to become not depressed from sugar pills because they believe, and we believe, that they're going to get better, right? And actually a lot of the studies on antidepressants before they were approved show that they probably don't perform much better than placebo. But what this gets to is our belief. So what is a belief? It's nothing more than a thought that you've thought thousands of times, so much so that it has become unconscious. You don't think about it, but it is a driver of your behavior. And it's something that you can't sense with your five senses. You can't see, hear, touch, taste, smell, right? But it's what I call the intangibles, along with your thoughts, your feelings, your beliefs, and also your connection to something greater than you. What are these? They are energy. You can't find them in the body. They do not exist in anatomic form. They are only energy. They are energy that defines who you are, right? So they're part of the energetic system that was defined by the ancient Chinese thousands of years ago, they access it with acupuncture. It's the energy blueprint of your body that forms the framework of your physical body that can be photographed with things like Kirlian photography, or can be measured with electromagnetic frequencies well outside the body, several feet, right? These are energetic forces that compose who you are, and they are vital for your health and well-being, but no allopathic doctor talks about this. And a lot of functional practitioners don't talk about it. You'll get energy practitioners who do energy medicine practitioners who talk about it. And for me, I really have a ginormous toolbox because I deal with the energy body. Homeopathics speak to your energy body. Informational tools like homeopathics, where the plants, you're just taking the energetic information that speaks to your energetic body. But you can learn how to work with this yourself. There's some great books I want to recommend. The Biology of Belief by Dr. Bruce Lipton. Fabulous book. Joe Dispenza has a book called Dr. Joe Dispenza, The Placebo Effect, that talks about what we're talking about. And really, for you to be the CEO of your own health means that you do need to investigate and learn about these things and understand and prove to yourself and find what makes sense for you. And then educate yourself and kind of have your boardroom of practitioners who help you. But we do the double-blind placebo-controlled trial, and the observer effect is, there's a great video on YouTube. I think it's Dr. Bob Green who did it, that has a cartoon that explains the observer effect, that based on what you believe about an outcome, well, actually just observing a study changes the behavior of what happens in the study. And so that gets to the power of the energy that we are, right? There's this energetic essence that transmits from us that we change just by looking at things. And Dr. Wayne Dyer says, when you change the way you look at things, the things you look at change. And it's so true. It's now been scientifically proven with the observer effect and the double slit science experiment in quantum physics, that we change outcomes with our observation. And so, this gets back to, I think, really knowing yourself, having that locus of control, paying attention to your thoughts and emotions, examining your beliefs. This is a lot of what I talk to patients about, but most people are like flabbergasted. They say, no one ever told me this. They have no knowledge of this. But what I want you to hear today is that, well, welcome to your energetic self. And this is a thing. And if you learn how to start working with it and harness it, you're going to reach levels of health that you might not have thought were possible, because I find that this is the missing link in a lot of people's healing, because this energy is the energetic framework of your physical body. You can't have a correlate, right? So you've got to address the energetic correlate in order to have complete physical healing.
Well, and I mean, I love this topic. I think it's also interesting to mention what's referred to as the nocebo effect, the opposite. So, for example, there's reports of things like this happening where a person has an illness and they go to a physician, the physician says, okay, you're going to die, you've got 6 months to live. That belief, then there are often patients who will then die like 6 months to the day. So I think this isn't about, for anyone who's hearing this and this is new information or it sounds a little bit out there for you, I think that what's interesting are the implications here, because I go on about the science, and it is helpful, obviously, to do double-blind placebo. I think we need to have a new word there, but placebo-controlled trials, so that we can verify if it's actually the drug, or if what the result is actually more than what you would get just by believing you would be better. So this isn't to say that there isn't room for this scientific inquiry, but I think the opportunity that this presents is that when you do have evidence-backed treatments, when you do have specific strategies that you're following to improve health, imagine then the possibility of harnessing that additional power of the mind that is mislabeled as placebo to whatever you're doing. I mean, what are the implications of that, combined with that empowerment piece of really trusting your intuition, taking your health back into your hands, and then utilizing all of these pieces that we've talked about as tools to improve your health. I feel like that type of knowledge and drive and empowerment can make a person unstoppable.
Absolutely. Yeah, that makes you unstoppable because you know yourself, you trust yourself, you know about your energetic self. You're intimately familiar with your thoughts and your emotions, which your emotions are usually in reaction to your thoughts. And then, like we said, your beliefs are thoughts you've thought thousands of times before, and you do become somewhat unstoppable once you learn about this energetic realm and you learn how to work with it and you uncover the underlying beliefs that keep you stuck. Like, a lot of people have a belief that if their parents had certain illnesses, they're going to get it. I can't tell you how many women have said to me, oh, my mother had a hysterectomy at 40, so it's time for my hysterectomy. Wow. They believed they would have problems like their mother did and need a hysterectomy. So they manifested problems. And then they said, I'm ready for my hysterectomy. So these, like I said, are subconscious. You're not even aware of them. Or this belief that you have a susceptibility to illness, like, oh, I get a sinus infection every year at this time. I can't tell you how many people who I talk to who say that. Well, what the belief that the nocebo effect that you're going to get a sinus infection actually does help to cause you to get a sinus infection. So once you learn about this and you start working with it, it really does make you unstoppable. I will say that, and this is where I've been doing a lot of my study lately, is in transforming belief, because a lot of our beliefs were implanted into us before we were 7, when we were this tabula rasa open vessel, and the beliefs were put into us by how we were treated and what we were taught about how the world works. And so sometimes those are hard to discern, but if you look at your life, you can see the outpicturing of your beliefs. And if you don't like what you're getting in life, then you can go back and say, oh, what are the beliefs I'm having? And so one of the beliefs that people might want to look at is, I believe the doctor heals me and that I have no power to heal myself. I really find that in a lot of people. And so you have to make it conscious first and say, yeah, I guess I do believe that. And then you have to start making it all conscious on a conscious level and asking yourself, do I really want to believe that? Does it make sense to me? I have a whole exercise I take people through with this to evaluate the beliefs that are outpicturing. A common one I find with the women I work with is, I work with a lot of middle-aged women who are in jobs that they hate, but they believe that that's all they can do to make the money to survive. But they suffer to make money. I can't do what I love and make the money I want to live. Like, there are all these beliefs behind it. And I find that a lot of these women they allow their boundaries to be crossed repeatedly. They will overgive at work. They allow themselves to be disrespected and they don't say anything. I have one client right now who, even though she was put home on social distancing, so now she's not commuting to work, her boss said, well, now you're going to work those hours for me.
Wow.
And she didn't say anything. And I'm like, oh no, I would have had something to say about that. So these are beliefs that you have to overgive to earn your worth, that you're not worth what you're getting paid. And, when we look at the paycheck discrepancy with men and women, I always, in the back of my mind, wonder how much we're participating with that. But in any case, looking at these beliefs, because, and this was true for me, I should speak for myself, I overgave. You talk about overgiving. When I was an OBGYN, oh my gosh, I gave and gave and gave, and it was like never enough until I depleted myself so fully. And so I had this belief that to be worthy, that I had to overgive beyond my capacity to take care of myself. And so really looking, I'm like, that's insane. No, I don't believe that. I don't want to believe that. And so the first thing is, awareness, acceptance, action. So I'm aware of it. Okay, I accept why I feel this way. A lot of it has to do with how I socialized as a female in our culture, because that's how we're taught. And then action is take contrary action. How can I do it differently? Well, I don't overgive anymore. I look inside and I say, what can I give with an open hand and loving heart? And that's what I give. And then when it starts to deplete me and says, sorry, no more, can't do it anymore. It has to come from a place of love and openness. And so I started doing it differently. And, sometimes when we take contrary action to what we believe, it can be a little uncomfortable. But then when you become intimate with yourself, you can learn how to process and work with those emotions and see where did they come from, usually from childhood events. Feel them, allow them, acknowledge them. You can journal and dialogue with them. There are all these tools you can use to really have that intimacy with yourself. So many of us are looking for intimacy with others in the outside world and what we can get, but we don't even know who we are. We don't even really know how we feel or what we think. And so one of the things I like to help people do, to get back to your point, Lisa, of that knowing yourself, right? I remember when I was a resident, this woman came in with a full-term pregnancy who said she didn't know she was pregnant.
Wow.
In fetal distress. And she was like a 23-year-old living at home with her parents. And her parents had wanted her to be a virgin at marriage. So she didn't want us to even go tell them that she was pregnant. It was just the most insane situation. But the bottom take home was, talk about being out of touch with your own body. And I wish I could say that was an isolated event, but it would frequently happen that we would have women come in full-term pregnant and say they didn't know. So it helps you to foster that knowledge of your physical body, but also your emotional body and your thoughts, right? Your thoughts and emotions are flowing throughout you, right? If you laugh really hard, you can feel how you feel. Like I encourage everybody listening, when you get done with the podcast, just think about something funny and just start laughing, or just start laughing. There's something called laughter yoga where you make yourself laugh. And then after a while, you're laughing for no reason automatically. And it does boost your happy hormones. And see how your vibration feels and your energy and what your thoughts are like and feelings after that. And then go turn on the news or go read a really sad, scary story or whatever, and see how you feel. And you feel constricted and down, and then see what happens to your thoughts and your emotions, right? They're in the toilet. And so once you start knowing this, then you can start working with your thoughts, feelings, emotions, and moving up that vibrational scale with your energy and staying more in gratitude and appreciation and openness and love and joy. And that improves your health, right? So your cells are all vibrating a certain frequency. Well, when you're feeling happy and you're laughing and you're in joy, they're all at a high frequency. And when you're in fear and constricted, they're all at a low frequency, and they function way better at a high frequency. So this whole issue of getting to your beliefs and the double, the observer effect and beliefs, I think this is the next frontier of medicine.
Mm-hmm. Oh, well, I couldn't think of a better place to end. I mean, we could have talked all day. I'll have to have you back again to jump into more topics. But Dr. Dunston, thank you so much for being here. This was so informative, and I just really appreciate this conversation. I think these are topics that we really do need to be exploring. I couldn't agree more that this is the new frontier of medicine, the incorporation of all these different modalities, instead of separating the human body into all these little parts and everybody having their own little specialization, which is also necessary. But I feel like there's a lot of value in having communication with all these different specializations so that we can really understand that this is one body, and incorporating these different modalities into care. I mean, just there's so much potential for human beings to be so much healthier than we are, because the information is already there. I think that's one thing. The information is already there. There's millions, if not more than millions, of scientific papers that have gathered all of this information. I feel like we really have everything we need for people to have a really amazing level of health. And of course, there's so much potential. So thank you for having this conversation with me and bringing these issues to light.
Thanks.
And you're welcome. And I want to invite you to share about your podcast, about your website, practice, so that the listeners know where to find you.
Sure. Thank you so much for having me, Lisa. I love talking about this stuff. I think it's so important because, like I said, a lot of people aren't going to hear it in a lot of places. So it's important that we keep spreading the word. You can listen to my podcast, Her Brilliant Health Revolution, on iTunes. And I think you'll really enjoy that. My website, I'll give it in case you want to look me up, is Kyrin Dunston, MD, and it's spelled kind of differently. So KYRINDUNSTONMD.com. And I'd love to share with your listeners, I created a meditation for brilliant hormone health. So I know you talk about fertility and menstrual cycle. And so it's a 20-minute meditation that I created to help people balance that energetic aspect of hormones that we talked about, right? So I think they'll really enjoy it. So I'd love to, if you can put the link in the show notes, I'll have to send it to you. I can't remember what it is offhand. I just want to offer that.
Okay, well, we'll definitely include that in the show notes. Thank you so much for being here. I'm really excited to share this conversation with my audience because, this is what it's all about.
Yeah, thank you again, Lisa.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/314. I hope that you enjoyed today's interview with Dr. Dunston. We could have gone on for a really long time. So for those of you who actually listen to the end, thank you for staying with us. I think I'll have to ask Dr. Dunston back on the show so that we can continue our conversation because honestly, we could have gone on for a lot longer. But what I really loved about this conversation was just to get that additional insight. I think it's so important for us not to give up on doctors. There are issues with our medical system and there are issues with the way many doctors are dealing with period issues, obviously. There are so many women who have negative experiences, who have period pain or different issues, irregular cycles, and they're really hoping to get to the bottom of the root cause and their doctors are telling them that it's not possible and all that. But it's really important to know why that is. And that's why these conversations going into it, talking to doctors, talking about med school, talking about residency, talking about what that experience is like, what you learn, and then finding out how it's often different to what happens in practice. These are conversations that are really important to have so that we don't lose sight of the fact that we do need doctors and we need to be able to work with doctors and we need to be able to understand where they're coming from so that we can advocate for the care that we need. We need to understand the role that doctors can play in our healthcare. And there are many areas where the doctors are more helpful in one area than another, for example. So it's really important to have these conversations so that we don't, let's say, throw the baby out with the bathwater. Because I'm sure I've mentioned this on the podcast before, but I've had a number of conversations with clients who are so proud of, I haven't seen a doctor in 10 years and I don't see doctors anymore. And I think, okay, well, we don't want to just totally cut out the concept of medicine. We need to understand where these doctors are coming from. Something I wanted to mention, I've been interviewing professionals. This will be the 6th year of the podcast coming into December 2012. So I'm in the 6th year and I've lost count of the number of professionals I've interviewed, but somewhere between 150 to 200 professionals, certainly at this point I've interviewed. And I find that I learn so much from professionals who've written amazing, well-researched books. I learn so much from professionals who have years of experience, but not just experience going through the motions, experience listening to patients, learning what works, taking it upon themselves to focus their attention and education in specific areas, who have really specialized in a certain area or field of medicine and really continue to grow. So I suppose I'm pointing out those who have really taken that interest in what really works for the human body. If you're using a certain approach and your patients aren't getting better, asking, why are my patients not getting better? And learning more and adapting and taking it upon yourself to do that independent and additional professional training and research to really support those patients to get better and then to start getting those results. And so I can't tell you how much I love speaking to seasoned professionals who have that level of experience and practice where it's not just following the motions, but it's really looking at like, okay, so I have these patients. I was taught in school to do X, Y, Z, but I've noticed that it's not working. I want to help my patients get better. So, what else can I do? And honestly, this is how we make the system better. This is how we improve healthcare for everybody. We start listening to the patients and learning about what works, because we are at such an interesting time in the world where there's so much information out there, and for so many of the common conditions and challenges and issues that we face, whether it's with the menstrual cycle and otherwise, there are often huge bodies of research, a number of professionals throughout the world that are successfully treating different conditions. And this would be such an amazing time to come together and really tackle some of these common health issues that we actually do have a lot of information and support and professionals actively treating successfully in non-invasive ways, with period issues being just one of them. So thank you so much, Dr. Dunston, for coming on the show. This interview, as I mentioned, I found it to be so informative and so important, and I always love having an opportunity to talk to a medical doctor. It's like one of my favorite things, because I want to know. I want to learn more. What was it like in med school? What was it like in residency? So that you can then make those informed choices. So with that said, I want to thank you for tuning into the show today. If this episode resonated with you and you know somebody who could really benefit from hearing it, make sure to share it with them, fertilityfriday.com/314. And I thank you all for being a part of the Fertility Friday community, for sharing the episode with your friends, for spreading the word about fertility awareness, and really just helping the women in the community and the world at large to empower ourselves with this knowledge. So with that said, I will let you go. And of course, as always, until next time, be well and happy charting.